Hello.
Hi. How are you?
How are you doing?
Hanging in there. I'm in Kentucky right now.
Oh, you are?
Yeah, my mom was in rehab, and she broke her pelvis.
Oh, I'm
so
sorry.
yeah, so I came last month, and I just came this past week too. I've got her dog, and he had to get some teeth pulled today, so I had to stay an extra day.
How's your mom doing?
She's better, but she still has some work to do. Yeah. So,
sorry, I'm in my
it
office.
happened. Yeah.
Yeah.
Oh, okay. Looks like, oopsies. I was worried about being late.
Autumn was saying she only heard from you and Rebecca, so
Oh,
looks
and
like
Rebecca.
so. I hope Shayla's the chair, right? Hi,
Yeah.
Hi.
I'm Sue. I don't think I've met you yet.
Hi, Sue. Sorry, I missed the last meeting.
Well, I'm the interim that's here until Diane's position is filled. I was the assistant director previously, but I don't usually attend these meetings.
Okay. Well, good to meet you.
Thank you. You too.
Yep.
So you guys have to help me out. There's Shayla. Yay.
Yeah, maybe they have to help you out. I've only been to like 2 meetings.
Okay.
Hello, everyone.
Hello. So if there's not enough people, we can't vote for anything, right?
Right.
We have anything to vote on?
Minutes.
I don't know.
You'd have to approve the minutes from the last meeting.
Is that allowed?
No, not when you don't have a quorum.
That's what I thought.
Sorry.
Next time.
Autumn, are there any other folks who've RSVP'd that we're waiting on?
Nope, this is it.
This is it. All right, so
It's like a little hard to keep momentum going when we've been meeting on Zoom for over a year.
it is. It's tough.
Well, I guess since we can't vote on anything, that it might cut it short at least, right? How's your new role, Sue?
I'm going to talk a little bit about that under the director's report.
Okay.
No, and address the Zoom participation too, actually. That's part of the city's plan. So I do have some information about that.
Okay. Well, I move that we start this meeting and yeah.
Second.
With the agenda. All right, Sue, welcome. Thanks for joining us. It's good to see you.
Thank you, Shayla.
So we cannot approve the minutes yet because we don't have a quorum. So I guess we should move that to the next meeting. I'm not sure what else is on the agenda. I haven't seen it.
Usually public comments, but I don't think there's any public.
No.
And then I think it's the chair report and then the director report after that.
Okay. Well, I have nothing to report as the chair.
Does that mean you're handing it over to me?
Yep, I'm handing it over to you, Sue.
Let me start with the lack of a quorum. And the city's website says that we have 3 vacancies on our advisory board. So, oh, good. There's Sina. Hey, Sina. Hi. I was just going to talk about the advisory board application process. We have a flyer. Autumn designed a great flyer that we're sending out to our staff in hopes we can get some people with lived experience to apply for the advisory board. But the city's website says there are 3 vacancies. So in most months, it might be that you do not have a quorum. So it's hard to move things forward once you determine what your priorities are going to be for the next work year. So the application process for the membership, as you all know, is through the city council. And the next time they're looking at that, I believe, is their second meeting in June. Is that right, Sina? Okay, got it. So would it be helpful if Autumn sent you all the flyer that we're sending out here?
Yeah.
Yeah.
Drum up some folks who might be interested. Great, okay. Then I just had a couple of updates. One is I hope you saw that the city's budget was approved. So for our department specifically, that's great news because people were worried, of course, about keeping their jobs, but also not getting a cost of living adjustment and what would happen with their health insurance premiums. But it was pretty good news for the budget, thanks to all of the counselors who made that work and the folks from the budget office. But one thing that we had put in our proposed budget, and I'm not sure if Diane has discussed this with you, was converting one of our foster care positions to a management analyst position to help us tie some of the program trends together and hopefully be more transparent about our caseloads and our outcomes and the demographics in our caseloads, and connect with other public and nonprofit agencies that are doing the same. But we were not allowed to put that forward. We'll keep trying that as we find opportunities. I know you all are concerned, and we are too. We're keeping an eye on what's happening with our foster care caseload. And at start of budget season last year, we had room where we felt like we would be better off with the management analyst than adding on a foster care worker. So we're going to keep trying that, but that was really the only thing that happened in this budget season, controversial for us, and that was not controversial compared to the rest of the discussion. But the one thing that did happen in the city manager's office and was part of the budget process was the hiring of the new deputy city manager for race, equity, diversity, and inclusion, Ashley Marshall. I hope you saw the announcement about that and read her resume. We're really excited about what she brings to the table. And we are one of the departments that will be reporting to her. So whoever the director is would be directly supervised by her. She's going to oversee DSS, the Department of Human Services, the Police Civilian Review Board, and the Office of Human Rights. So she has a lot on her plate. I wanted to talk a little bit about employee vaccination and then the reopening strategy mostly for our department, but also a little bit for the city, just so you're aware. The city has made a great effort to prioritize vaccination for employees. So, at this point, every employee that indicated an interest in getting vaccinated has been offered at least one appointment and probably already has their first shot. For our department, we've got roughly 80% of our staff is vaccinated. Everyone who is fully vaccinated who indicated an interest, and only those who declined or were unable to at this point have not been vaccinated. So we're really thankful about that. As far as reopening goes, the city has announced the earliest they're going to open buildings to the public is the Tuesday after Labor Day. We have really found that pivoting to remote work, our staff is generally very pleased with that. They feel that it has been helpful for them managing everything else that they've had to deal with over the last year, couple of years now. And there's much of our work that we can continue to do remotely. And anybody that wants to keep working remotely and is in a position where that makes sense for our business, we're going to allow them to continue to do so. So even when the building opens to the public, the only thing that the city manager has said is that if a person comes in off the street, like in the old days, they have to be able to get the same level of service that they would have before your new business model was in place. And we feel confident that we could do that. We put our group of supervisors, maybe you've heard Diane talk about our CI team. It's our supervisors who really are charged with being innovative and doing some brainstorming and making sure that decisions that the leadership team makes make sense for all the teams in the department and the people that we serve. We've asked them to help us develop the initial mainframe for what it's going to look like when we come in. But the minimum is anybody, staff or public that enters the office and is in a common space will have to wear a mask. And that's a city policy. That's not our department. And for our department, we do not intend to have interviews in private offices. We're going to designate certain spaces that we can better track if there's an exposure, and it's easier to create smaller spaces. So we're just going to work on a robust sign-up system for any in-person contact that actually has to happen in the office, which isn't much, honestly. Any questions about that? We get a report from our team. The initial report's due today. Their final report's due the first week in June. So we'll have something more for you at your next meeting, which would be June, I guess, right? Oh, I did want to I'm assuming Diane updated you on our workloads on a period with some level of periodicity. And that may be something you want to talk with the new director about making sure that you get reports on what's happening with our workloads and our outcomes. Because right now we're not doing a great job of updating our department website. We're several years behind there, but so that's certainly will be a priority for the new person, I think. But our workloads, interestingly enough, contrary to what you have heard in the media, we have not seen a rise in our child welfare caseload at all. We have not seen a rise in the number of CPS reports or in the severity of the reports. We have had some pretty significant CPS cases, but there's no difference in our assessment between of severity with what we experienced in this time 3 years ago, even. So contrary to what you saw in the local press, maybe around child abuse awareness, we have not experienced that here in Charlottesville at this point. Now, of course, everyone says, but now the schools are in, and that may well happen, and we're ready if it does. But right now, we have not seen an increase. Where we have seen a significant increase is in our public assistance caseloads. Not really our TANF caseloads, but the temporary assistance to needy families. I'm sorry, not sure at your level of familiarity on that. If I say TANF, you're nodding your head, so you know what I'm talking about. All right. So that's a time-limited assistance program, and it may be that the people that needed TANF because they lost jobs were not eligible because they've already timed out. That's something on our long-term, like if we get a research graduate student, we want to put them on that and help us figure out why didn't our TANF caseload goes up when we know there's an increased financial need in the community. We have seen significant increases in our food stamp caseload, and in particular in our Medicaid caseload. Medicaid caseload has really been affected by this public health emergency declaration, where both the state and the federal government have said if you are receiving Medicaid, your case will not close during this public health emergency. Virginia is extending that public health emergency in 90-day increments. So right now we have an extension that takes us through, I believe it's the end of June. But we're expecting, the federal government has already said that it's not likely to end before the end of the calendar year. So we're expecting to see that too. That's a great thing for people that have Medicaid now or that come on to Medicaid. But one place where it is causing a problem is folks who are in long-term care facilities, because their assets might be accruing to a point where they might not be eligible for Medicaid by the time we actually have to close cases. But right now, we're not closing any cases. The other significant thing that affects our benefit program's workload is the changes to the child care subsidy program. The income limits for that have been increased, and we're now allowed to cover child care costs for people who are doing job search. So we are expecting that we'll see here in the next month that was just a change that just happened. So we're expecting we'll see immediate increases in that, because we're really working hard with the providers and the public to make sure that everybody knows about that. Then the last thing I had on my list was an update on the department leadership. So as you know, Diane retired the 1st of April. I was appointed the interim director, and the application process for the permanent position has closed. We do not have any additional information on the timing for the interviewing of that. My opinion, which, you know, with that you probably couldn't get a cup of coffee, is that we won't hear anything about that until Ms. Marshall joins the organization, since the director would be reporting to her, and it's really only another 6 weeks until she's here. So, but you never know. So we're muddling through. It's been difficult with Laura out, but we're doing what we can. So, any questions for me?
I don't have any. That was really helpful and informative, so thank you.
Actually, I have a question, sorry. Maybe you talked about this last meeting, but where's Laura at this point?
Oh, Laura's out on an extended leave. She'll be back the middle of May, but she's
Okay.
since the first part of April, so.
Okay.
Actually, she went out in March, right before Diane left. So,
Mm.
Is she okay?
yeah, she's okay. Thanks for asking.
Yeah.
So, Sue, if you were talking about the job search getting childcare, I was under the impression that that was already happening through the VIEW program. Is this different or?
It's for as long in the VIEW program, you could have 2 weeks of job search covered. Now it's unlimited job search.
Oh,
But
okay.
anybody that's receiving child care subsidy can have their child care covered during the job search period.
Okay.
Glad to hear the vaccine results. That's better than trending in a lot of other places. So
Yeah, and our department is one of the more highly vaccinated departments. As you can imagine, we were one of the priority groups. So, and at this point, we're still not required to see anybody in person except any of our protective service investigations. We are doing more and more in-person visits as our staff has been vaccinated. For example, in our foster care caseload or our foster care prevention caseload, we ask, I'm vaccinated. Are you comfortable if I come to your house? Have you been vaccinated? It's a nice day. Can we meet on your front porch? You know, I can bring a chair. We can sit outside. We try and be creative to increase our personal contact whenever the families are open to it. When it's something that at this point we're not mandated to. We know that's why people get into social work. They like to have human connections. So.
So do you think that benefits workers will maybe come in like once a week to schedule for people who want to be coming in face to face, but then remotely the rest of the time?
I think for our benefits staff, we're really trying to have this first phase both meet the service level expectations for the city, but also meet their personal needs. You know, people there's still a lot of unknowns about summer camps and other types of jobs and schools next year. So we are really encouraging people to keep teleworking so that we have less exposure in the office for our staff and for the public. You know, we can't tell people who's vaccinated and who's not, and we won't know that from the public either. And the teleworking we haven't seen any adverse effect on our outcomes at all, despite the increases in our caseload. Our overtime costs have not increased, and our performance measures are good, at least where they were 3 years ago, which is what we're using as a benchmark. So I don't see any reason to have people come in if they don't want to. If they want to, it's not going to be the same. We won't be interviewing in the offices. I imagine most of you have heard that the county is probably keeping all of their benefit program staff remotely and is moving to change their job descriptions to require remote work. We're not at that point yet as an organization. We don't really have a master plan, but I know there's a lot of people with better perspectives in mind that are starting to work on that now that some of the other leadership positions have been filled, and we can move to a longer term view on how we do our work and still meet the needs of the community.
I mean, I think it's wonderful. I think this is one of the few benefits we're getting is that, you know, people who thrive working at home have that option to be able to work from home. Also now if somebody moves, we can continue to employ them potentially instead of losing them.
Yeah, and one thing I'm sorry I forgot, but I did want to mention, Sina, you probably have much more information on this than I do, but you all were talking about this kind of Zoom tiredness with meetings and how hard it is to get momentum. And I know for this group in particular, we haven't done, it hasn't been easy to fill vacant spots, and you don't often have a quorum, which is frustrating for everyone. So as long as the public health emergency stays in place, the city will continue these types of public meetings in a virtual only format. If we go to a hybrid type of participation in the community, once the public health emergency ends or is amended, board members would be required to be in person. Staff and public could participate either in person or remotely. Do I have that right, Sina? No.
I honestly have no idea. I'm gonna be like,
But right now,
That-
it's all remote, and it'll be remote at least through the fall.
I mean, that sounds about right. But that was a city manager policy.
I'm wondering, just because I haven't been to any meetings in person, if they're in person, will we be in a big enough space to accommodate everybody do social distancing? Or,
We would have to do that. We would have to do that.
okay, I didn't realize there was a space big enough at social services. That's why I was wondering.
It might
Would-
not be here. We were meeting in the base, you all were meeting in the basement conference room, I think, right?
Yeah, basement at City Hall, but even that, I don't know if that's really big enough to
Yeah.
put people 6 feet apart for this size of a board.
The other thing that the communications team from the city's been doing is retrofitting, for want of a better word, some spaces in and around City Hall to accommodate that type of hybrid format in a way that's easy for people to access. So we'll know more in the next, I would say, month or so. Certainly well before September when we open up.
I'm wondering if we'll need to do something like Key Rec or something like that.
Rebecca?
I'm wondering, and maybe Sue, it should wait until a new director's on board, but I guess I'm wondering if it would be worth talking about the malaise on this board, and what that might be attributed to. I think there was some even before pandemic. I've been on the board for, I think, over 3 years. And I think it's obvious to some extent why during a pandemic year when you're meeting on Zoom, there would be malaise, but I think it could be helpful and interesting to talk about that.
Yeah, I do feel like that probably needs to wait for the next director, assuming there'll be somebody in place, certainly by the 1st of July, if not for your next meeting in June. But yeah, I agree, just in reading back through the last notes.
Maybe Autumn could flag that as a future agenda item.
Maybe the fancy new flyers will change all of that.
Well, I guess personally, since I had just started and then the pandemic hit, I think I had 2 meetings before the pandemic. Historically, what has the board done that's beyond just kind of checking in? Have there been any projects or any steering that the board does? I'm just curious. And again, during COVID, it just wasn't that time to be it was just like, all right, let's just deal with the emergency that's going on right now. But I mean, does the board ever take on any projects?
I think that's why I've felt malaise. It just doesn't feel like this board does a whole lot. It feels like we do just kind of hear reports and we do our report once a year. But just from what I've heard of some other, boards in town who are really active, it feels like this board doesn't do much. And I guess I've wondered if that's just the way this board is, or whether there's a need for that to change at all. So I think it'd be great to talk more about it.
Sue or Rebecca, do you have any insights or ideas of what you think we should be doing? Because I also joined like right before the pandemic started. So all of my meetings with this group have been virtual. And I agree with you. I think there is some malaise with the board, but I just don't know how to improve it, especially now, in pandemic times. But I would love to be more active in this board.
Janet, I'm very sorry I got here late. I had to go to Richmond and I rushed back. I'm illegally parked, but I'm here. And I want to say, I think if the discussion is what is the good is this board, I think we've just been so fortunate to have a social services department that has been so well managed that there's not been a lot of things to do. And I think that was really exemplified during the pandemic when there were so many more people with so many more needs. And yet the Department of Social Services stepped up and improved a lot and managed to meet many of those needs.
Well, it might be worth you all talking with the new director and Miss Marshall, who will be in place too, about what she sees to some degree as an advisory board. You're a little bit hamstrung in your role in the organization, but I think if we can get you some current program data, performance data, and caseload data, and show you some trends, which at this point, I mean, we kind of have to just block off a couple years for COVID when it comes to trends but I think outcomes by race, gender, ethnicity would be interesting for you to look at. There's, I know you all have received the three phases of the studies we did with the UVA UVA Library of Public Interest Research, I believe is the their full title, but they did a disproportionate minority contact study on our child welfare caseload, and we didn't get one for last school year, but we are hoping to be back on track with the fall. And one interesting thing that is going to happen in the fall class is they're going to do a similar study on data from Albemarle County. So we have not had that comparison before. We've just had longitudinal from our own caseload. So that I think would be interesting for you to look at, and I think you could perhaps find projects or actionable items that would be consistent with the expectations outlined in the governance for the advisory board.
Yeah, I mean, I think if we could find a project that the board was working on in its advisory capacity that could benefit social services by either bringing forward, investigating some other information that's being, projects that are being done in other places that, might be able to merge with some new phases of integration into how we're doing things. That might be something that the board can do to bring forward some new ideas, but not just the ideas, but also how they could potentially be integrated into current practices. Yeah, that's all.
At one time we had decided that we were just meeting too often and decided that perhaps every other month was a possibility. Is there any more discussion of that?
I think right now you all are still meeting every other month, so we can continue that. But I'm sorry, Shayla, I don't mean to hijack. I would just say in my experience here in the department, the advisory board has always picked their project, and typically it's an interest area either for one of the board members or because there's a new program and they've just spent the year learning about the project. It might be that the department pitches the project to you. Another initiative we have in our child welfare division is a parent navigator. We converted a position to a parent navigator. I'm sure Diane filled you in on that, and in hopes of addressing one area where we chronically missed our performance benchmark was timeline to permanency for kids leaving foster care for whatever reason. And we were hoping that this parent navigator position would help us get kids home faster. So that position's only been in place for about 6 months. She came in during COVID, actually. So, by next year, we might have some data to look at what are we doing well about that, because other cities that have tried that, there has not been much publicly reported data. We actually got the idea from Washington, D.C., and NEKC is supportive of the model, but we could use some help figuring out what are good indicators that show that is really making a difference.
Shayla, do you mind if I bring one more thing up? just to flag for future, I know this is a little controversial, but I'm really interested in how cities can spend less on police and more on vulnerable communities, and how we can shift some of the roles of the police. So I'd be really interested in talking with other folks on this board about whether there are ways that could happen with the systems that we're involved in.
That's a great idea. I completely agree with that.
Tina, did you want to say anything about the work that's already being done in the city? We do have a representative on I'm not sure who convened that work group, Tina, but it is to look at alternatives to mental health responses, alternative to law enforcement response to mental health.
Right now, we have two unofficial task force. They're unofficial for a couple of reasons. One being just we wanted to make sure the communication specialist wasn't getting overwhelmed. So I was asked to be on the mental health task force, and we did intentionally ask a gentleman from social services to be a representative on this board, partially because, I mean, we sat down, three of us went through the people we knew, who we thought would need to be representative and agency wise, but then also who we knew in the community who could also potentially bring a voice that wasn't always heard. So we have a local pastor, we have the fire department, the police department. We have a gentleman in social services, who actually, he oversees the front desk area, right? And so it's that entrance area where people first come in. And also we work together at Potcham as well. So I know, we just happen to know that how many of the people we've asked to be on the board, some of them wear like 3 or 4 different hats based on their experiences. So we're struggling through trying to figure out where we want to focus, because when you start looking at the whole intersection of police and mental health, we keep hitting some really significant problems. There's still a lot of rules from the General Assembly and laws that say police have to be involved in X, Y, and Z. Like when somebody is called, usually for a lot of times mental health calls come in as a disturbance of the peace. So we're also looking at the 911 center and trying to figure out what training 911 operators need. And we're trying to come up with a place, potentially like where Region 10 crisis clinician sits in the 911 center for a couple of weeks and looks at the calls and listens to the calls, and they would classify it one way and seeing how the 911 operator would classify it to kind of figure out the differences and what the end result was. But one of the really huge issues that everyone is facing right now is there are no beds. If somebody is in crisis and is in a place where in their mental health that they would be involuntarily committed, and what it is there's no place for them. There's no beds available. And sometimes police are having to stay with somebody for up to 30 hours and transport them halfway across the state. And once a police officer brings somebody in, they have to stay with them. A lot of this has to do with what happened in Blacksburg. There was a lot of laws changed. And so there's that problem. Another problem is there isn't a really good crisis intervention before somebody is a threat to themselves or others. Region 10's got the Wellness Recovery Center, but that's 14 beds. And then there's the Arbor House over in Harrisonburg, which I believe is 10 beds. And that's about it as far as, and that's if you feel like you're not quite in crisis yet, but are getting there. But then again, you also have to be, your physical health has to be pretty stable. You also can't have really any co-occurring addiction issues going on at the same time. Because they don't have the medical facilities to manage it. And it's also a totally voluntary thing. And having worked in mental health for 17 years, a lot of time when somebody is at that crisis point where they're kind of teetering almost to a threat to themselves or others, they don't want to interact with other people. They don't want to go someplace voluntarily. And it just becomes, and the police and everyone knows that the police are the wrong people to be there in that moment. But the way the state and the federal government have constantly been cutting funding to mental health over the last multiple decades, that was the only place that it ended up landing. So we're trying to figure out how to develop something, what our recommendations even would be, also what recommendations we might have to the General Assembly as far as starting to change some of the laws to allow clinicians. But I mean, I will also say I have been somebody who've had, when I was working with somebody in mental health, I have had a knife pulled on me. I have physically been in a couple of instances where even though I knew the person really, really well, and we were on really great terms, right then, their mental health was in a place that they were a threat to others. And I really didn't feel like anybody else was capable of potentially bringing them into the hospital but the police. And it's not something that we want to happen. But when somebody is really deep into a crisis situation and they really feel that everybody is out to get them, things can blow up, and it's not always because of a police officer. It's a very complicated thing, and we have to make sure that, as it's going to take a lot of funds, because what we're going to have to do is we're going to have to build something first before we can withdraw the police, because otherwise, I was talking to somebody about this the other night, otherwise what's going to happen if you withdraw the police from the situation, there's nothing there to take it right now. And what's going to happen is people are going to die. More likely they're going to kill themselves. Because most of the time when someone is in that state, they're more of a threat to themselves than anybody else. And we were also seeing a lot of overdoses right now. Heroin and fentanyl epidemic is starting to go pretty high. And sometimes police are what can bring somebody in to stop them from ODing. Because again, we don't have something built yet to take that whole. So that's also, the mayor has got a group going where it's about policing in Charlottesville, imagining a just Charlottesville group. And that's looking at policing as a whole, a larger aspect in the community. But if anyone heard at city council meeting the other night, we had an instance where someone called in the police for a gentleman who was scaring his neighbors. They didn't know if he was having a mental health crisis. They didn't know if he was on something. The police came, they talked him down. They still don't know. But I mean, the neighbor is still she's feeling very threatened and worried for her own family. So we've also got to make sure we somehow address that in a neighborhood as well, that people feel safe as well.
So it sounds like you guys have a lot of areas of interest, and I think the department can maybe pitch some ideas to you of things that we'd like you all to look at and help us figure out how to move them forward. But maybe the first step is to get a solid list from you guys about what your topics are that you'd like to address. I do think that's probably a discussion for the next director, but between now and then, I can work on putting it together so that there's a soft handoff on that and work with Ms. Marshall on how that fits with her priorities.
Does the Department of Social Services have ideas of what the social safety net is not catching? Like what are, we have often heard reports of what is being done, but I mean, I guess homelessness is an issue, and Senna's pointing out issues of mental health that are issues. Or do we have a list? I mean, I feel like what's being done, we don't need to do anything more on, but are there lists of things that aren't being done that we could work on?
I think it would be helpful for you all to look at some of our the reports and what our outcomes are, particularly by race, gender, and ethnicity. And I'd be happy to pull those together and send them out to you in advance of the June meeting that might provoke some thoughts on what isn't being done. How does that sound? Okay, sounds good. And then we could keep talking about this all day because I do think there's a lot of potential for this group. But I saw Sina's note, and you know, it might be that what you all want to have some input to the legislative agenda for the city. You know, that may be a possibility, that because this is what we see in our social services department, we think the city should support this type of legislation, and it might even just be adding on to what the platform already is. We used to have a lot more input than we have over the last, I would say, 10 years, but I see.
I'm on the legislative committee.
Oh, yeah.
Of course you are.
Do we have specific proposals to take to our legislators? I'm more than happy to do that. But I mean, just going and saying there's a problem isn't going to get us anywhere. We need to have a proposal that we want them to support.
And I think that's where Sue's reports that she's going to send us will come in handy. We can start to research that on our own time. And then next time we get together at our June meeting, we can discuss, you know, what are the top priorities for us as an advisory board. And we can take that to the new director, to Sue, whoever we need to, and get some momentum going on that.
And then that person would work with the legislative committee from the city, legislative priorities. Right, Sina, that's how it would fit. Yeah, we wouldn't go.
Yeah.
We wouldn't go directly.
Yeah, the legislative committee is really just to sit there, and it's me and Lloyd, the legislative committee. And I didn't know this when I was like, I want to be on that. But I mean, it's good because what it is we're supposed to be out there kind of feeling with the other counselors and everybody and pulling it forward. But additionally, I'm also on the Virginia First Cities Committee for Charlottesville, and I've just been asked by the Virginia Municipal League to be on their legislative committee.
Sure.
So I'm really happy if we start identifying some stuff to not just bring it from Charlottesville, but also start pushing it on some other statewide, because we've got some pretty open-minded and human rights and human services centered legislators personally in our area, but they need votes across the state. So I'm also happy to also start, you know, feeding these to other places as well, to start getting more help. And I mean, it's important to know, like, our legislator can usually only take like 5 or 6 items and bring them forward that we present. So if it's something that we should also then, if we find some things that we think are really important, we should also reach out to Albemarle County Social Services Board and see if they're interested as well, because we all share So David Blount is our legislative person, and he's the lobbyist, but he's for Louisa, Fluvanna, Charlottesville, Albemarle, Greene, and out. So he's for the whole area. So again, if we identified some things, and I don't even know if we could do it this year in time, but if we identified some things in the next year to bring forward for the next year even, and then as we identified it, we reached out to the other social services and the other counties that they might be behind it too. And then that makes David's job really easy.
And that process for housing, mental health, or other types of legislative needs is the route to go. Specifically for social services laws, the director of each department sits on the legislative committee of the Virginia League of Social Services Executives, and there's a similar process for that. That's a statewide process. We introduce a legislative agenda to the General Assembly through the force of all of those directors. So your position would be taken forward through this department to that body to say in Charlottesville or in Charlottesville and Albemarle, this issue is really important. Just specific to social services legislation. It might be things like drug testing for TANF. That comes up every year, and we always go in and oppose it, right? So, but not every area of the state does. So that's another vehicle just for specific laws that might affect social services programs at a state level.
Are there COVID funds available that could be used for extra mental health beds? I mean, you've identified a need right now that money could solve, I think. If we could, do we have a proposal of where we could put extra beds if we could get the money for it?
Well, we are using some COVID. We use some COVID funds to house homeless folks in a hotel during at the first phase of COVID, and as more dollars became available, we worked with nonprofit partners and the Community Foundation to purchase the TJAC, of which our department is a member. I sit on that board, to purchase a hotel. That's our big effort as far as addressing homelessness, using those dollars that became available because of the public health emergency. So that's one thing. Specifically mental health beds, it's not so much the funding, it's just the number of beds. That is, from my perspective, that's a problem. There are just no beds.
Well, and they've been systematically cutting them. So I don't know if many people know, but we used to have either 12 or 16 more beds in Charlottesville than we do, because when Martha Jefferson moved to the new building from the old building on Locust, they shut down an entire unit that had been rented by UVA as an expansion. It was called Rutger 3. And so we lost all of those beds because there's been a huge push over, starting back in, it was a good push back in the 60s and 70s to have people leave mental health institutions and not be institutionalized their whole life. And then that funding was given to communities and it helped support, but then slowly they just keep cutting that funding every year instead of even increasing it for cost of living. And so and Western State has closed some more beds. There's always the push from Western to get more people out, to have fewer beds. That's UVA's always pushed to have, like, if you're in a psych bed for more than 14 days at UVA, you're sent to Western State. Then there's also a big push. There's not a lot of inpatient drug and alcohol treatment anymore. Region 10 started this a couple of years ago, started a women's center, which is also designed to have, so a woman can have children under the age of, to come in who are under school age with her, so that, because that was a huge problem that was identified as, what are you supposed to do with your kids if you need to get treatment and help? And that's also a problem in mental health too. So there's a lot of holes. It's a little overwhelming sometimes. I mean, I guess Western State could potentially increase more beds, but so many people, if you even hint at going to Western State, it terrifies them.
Sina, do you know if the city has ever tried to encourage beds for youth? Because I know that it's really hard to get beds in the state of Virginia for youth. And to me, it seems kind of shocking that we have UVA and Martha Jefferson here, and we have no beds for adolescents or kids. And they have to go sometimes across the state for treatment. And that is a huge burden on those families.
A friend of mine's daughter, that's what happened to her. Yeah, she could either go to DeJarnett or she could go to, I think she ended up someplace in Richmond. And, being 80 miles away from her family was not a very good healing experience. Yeah, that's regretfully, I mean, honestly, a lot of this, when we're talking about funding, we're talking lots of funding, and also lots of funding committed into a line item in the state budget, because Charlottesville, we're having this problem. It's happening everywhere. And
especially now.
Yeah, it's, we need to have crisis centers all over the place, and we need to have short-term beds for people. We need to have adolescent facilities. Again, adolescent mental health is different than adult mental health, partially because adolescents are much more likely to, their impulse control is not as developed. So they're much more likely to act out immediately without stopping themselves. So,
that is a service gap that has again been identified by the community policy management team, and they actually have their retreat next month to identify priorities for the next year on how to. So one of them is to expand mental health services to youth, including inpatient beds. But there is some new opportunity this year with the Family First Act and funding funding streams that become available for some mental health prevention and wellness, mental health and wellness initiatives that we didn't have funding for before. So hopefully we'll be able to make some progress on that. But
do you know?
How
I'm
you
sorry.
Overlap with CPMT as far as those priorities? That's an area you may want to look into.
Sue, do you happen to know if they are also talking about? I mean, I realize the schools are saying that they're going to increase the mental health supports, but do you happen to know if, because I know that there were some workers, the name is escaping me right now, that the people who came into the schools and worked directly with the kids.
Therapeutic day treatment.
Yes, TDT. They canceled it in all the schools, and I like maybe last year before the pandemic, and I feel like we need it now more than ever. We needed it then, and I just feel like
can explain that.
Pardon?
I can explain what happened if you like.
I think it was a Medicaid funding issue, but yeah, but I just also like at the high school, at the middle school, the guidance counselors are spending a lot of their time doing scheduling and paperwork and meetings for IEPs, et cetera. We need people who can work with kids. I mean, we have one Region 10 therapist there at a time, and we sometimes have people who work for other outside agencies. But I feel like we need in-house people at our school. I know there have been 2 at Charlottesville High School, but that's also not enough for 15, 14, however, 1,200 kids. And like you said, Sina, the majority of them are experiencing a lot more issues. And with the prefrontal cortex not being developed, the impulses to do things are definitely probably higher.
I can appreciate your all's passion about that issue. I do feel that that is probably right outside of what your mission is, because that would be the school's budget, school services, but we could document the need for that. And that is something that I feel falls within your scope of responsibility.
Okay, I didn't know if it was like they collaborated together.
We do collaborate together in that we work with kids in the schools, but when I say that, I'm thinking, and I'm new to this too, but one of the things you might want to look at is reason kids come into care. How many kids are coming into care because they're in a mental health crisis? Or how many responses do we have to a school because there is a situation that the school can't manage?
Okay.
Those are data points that once you establish your ask, we can supply the information for you.
Okay, thank you.
Did we make a quorum today?
I don't know how many folks were missing, because I know some folks have dropped off the board. So I don't know what the amount should be versus how many we have here. Autumn, do you know?
Well, we have 5, so yes, we do now.
Okay.
Good. Because I know we have to have how many, Autumn, how many meetings do we officially have to have a year?
We have to have 4, I believe. 4 meetings in a year.
So we have succeeded in having 3 this year, right? Now, this would be the 3rd one we've had that has actually had a quorum.
Yes.
Yes. Okay. I just want to make sure that we meet our bare minimum of legality.
All right, so we can vote on minutes. Has everyone had a chance to read them? Okay. All in favor of approving the minutes from our last meeting in February? Say aye or raise your hand. And those who oppose? All right, passed. And is there anything else we need to vote on that any of you can recall?
Could somebody summarize what is going to happen for the June meeting? Is it does Sue Moffett have the only action?
That's my note, was that I was going to get the most recent outcome reports out to you all.
That's what I have as well.
And Autumn was going to get the recruitment flyer out. So we'll send that all together in one email.
Do you think we could invite the new director for both? I mean, hopefully by June, we'll have both the director of social services to introduce and also the new head director. Should we invite the we keep changing the title, and she's a wonderful person. I actually was in her interview and I am so happy she chose. I think she's going to bring a lot to the table.
You can get an invite out to her. Actually,
or would we want to wait to the next meeting?
The June meeting. Let's see if we can get her for the June meeting. We can get on her calendar now. I know she's coordinating.
Yeah, because that's actually is our next meeting, right? The June meeting.
Yeah, you and I can talk about that when we meet this afternoon. Okay.
We're meeting this afternoon?
Autumn and I are meeting.
Oh.
All right, and for the rest of us, between now and June, if you want to start thinking of some topics that are DSS related that you think we could take on in an advisory board capacity, you're welcome to compile your thoughts and email them to me, and then we can hash them out at the next meeting. All right. Any final thoughts before we wrap up?
Thank you for being chair, Shayla.
Hey, you're welcome. I don't really feel like I'm doing that great of a job, but we'll just see how it goes. But thank
Awesome.
you.
Taylor, do you have your correct contact information now?
I'm sorry.
Do you have your correct contact information now? 'Cause I don't have it. Great.
Yes, it's still the same.
Thank you all very much.
Yeah, thank
Thank
you. Great rest of your day.
You too. Bye.